Hello, I am Dr. Renuka, Senior Fertility Consultant at Medicover Fertility, Hyderabad. Today, our topic for discussion is Ovarian Reserve. The fertility potential of a woman is determined by many factors, among which ovarian reserve is one of the most important one. So, to start with, let us know what ovarian reserve is. So, ovarian reserve is now we can say a girl is born with certain number of eggs at birth, so around 2 to 3 million, and from then on, around hundreds of eggs will be dying each day. And by the time she reaches maturity, she will be left with around 2 to 3 lakhs of eggs. That means when she is born, she will be having around 2 to 3 millions of eggs in her ovaries. But by the time she attains maturity in a span of around 13 to 14 years, she will be left with only 2 to 3 lakhs of eggs. So once she attains maturity with that one ovulating egg, again many hundreds of eggs will be dying each month. So and the egg count will be reducing every day, little by little. So it is said that a woman loses around 10% of her eggs in a year. Her reserve drops by 10% every year. So, because of which, after the eggs are completely done, she attains menopause. That means cessation of her menstrual cycles. So, to simply say, ovarian reserve is nothing but the amount of eggs the woman is left with at that particular point of time when we are testing for these things. And we have two important methods to test for ovarian reserve. Number one is AFC, that is antral follicular count, and the second one is AMH, that is anti-Mullerian hormone. AFC is nothing but the number of eggs which we see on ultrasound when we do it on second or third day of period. These are the eggs which come into growth phase in the first half of a menstrual cycle. So this count is proportionate to the number of eggs what you have in your ovaries. That means if on ultrasound, if you see more number of eggs, that means you have good ovarian reserve. If on ultrasound, if you are seeing less number of eggs, that means you are having less number of reserve or less amount of reserve. So, and the second important test is AMH, which is a hormone which is produced by the eggs which are there in your ovaries. Again, similar to your uh, antral follicular count or AFC, this AMH is also proportionate to the number of eggs which are left over in the ovaries. So both antral follicular count, AMH, they keep coming down as you age. So both are very simple tests. Antral follicular count is done by a simple scan, preferably in a transvaginal way, best done in your first half of the cycle, which hardly takes around 2 to 3 minutes of time. And AMH is a simple blood test which we can measure in your routine blood sample. And depending upon these two tests, we tell that well, you have normal reserve or low reserve. So once we have done your, once you know what your ovarian reserve is, which is very important because it will tell us about your reproductive span and potential. That means it will tell us how much time a woman has to conceive, and also it will tell us about the chances a woman has to have a pregnancy. Along with that, it will these results will also tell us or help us to decide what kind of medical treatment a woman needs when she is having fertility issues. And it also sometimes help us to predict the success of the fertility treatments what we give to the women. And these tests will also tell us about your ovarian age. So usually uh, your actual age should correlate with your ovarian age or the biological age of the ovaries. But for some reasons, nowadays we are seeing a lot of disparity between the actual age of the woman and the ovarian age. To easily understand, let me say that a woman of we have a woman of 25 years and we have done ovarian reserve test to her. So being 25 years, uh, her ovarian reserve test may not match to this 25 years values. So though she is 25 years, the test results will look like, or the ovaries on ultrasound will look like that she is around 32 to 35 years. So the actual age of the woman may not match with the ovarian age. So we have to keep even this aspect in mind before taking women for fertility treatments when she is having a difficulty in conceiving. And after knowing what this ovarian reserve is and what ovarian reserve tests are, the next question which comes into anyone's mind is what are the normal values. So the normal values usually they depend upon the age of the woman. But irrespective of the age, we say a woman has normal ovarian reserve when her antral follicular count or the egg count, simply to say, uh, uh, is around 15 and more, and her AMH value is more than 2.5. And also, a woman is said to have borderline ovarian reserve when her egg count is between 10 to 15 and her AMH value is between 1.5 to 2.5. And a woman is said to have low ovarian reserve when her egg count is less than 10 and her AMH value is less than 1.1. And a woman is said to have very low reserve, very poor reserve when her egg count is less than 5 and her AMH value is less than zero point 0.5. And we usually recommend these tests to women who are planning for pregnancy and they are not able to conceive. That means who have some fertility problems. Sometimes, in special situations, we advise certain women to undergo these ovarian reserve tests even though they are not planning for pregnancy, like women who have who already had surgeries on their ovaries or who are planning to have surgeries on their ovaries because of certain conditions like cysts or endometriosis and etc etc. For these women, even though they are not planning for pregnancy, we ask them to get these tests before and after the surgery just to see how much damage has been done during the process of surgery and to plan accordingly. And also we advise these tests in women who have undergone chemotherapy or radiotherapy or who are about to undergo chemotherapy or radiotherapy for their any cancers they have, and for women who have long health autoimmune conditions like basically rheumatoid arthritis or thyroid conditions, we advise ovarian reserve test little more frequently to see how their reserve is. And also, we recommend these tests for women who have family history of menopause and who have family history of fertility and some genetic conditions where it runs in family, which may result in poor ovarian reserve at later age. We recommend these tests to these kind of women also. And one more important thing is we also recommend these tests to women who are obese. And in above these these category of women, they have tendency for their ovarian reserve to fall rapidly because of their health condition. So it is very important to monitor their ovarian reserve so that we can take timely action. Similarly, we recommend these tests to women who want to postpone their marriage and childbirth so that we can be and take timely action so that women doesn't into problems later on. And also we can do these tests in women who have previous experiences especially in women, those who women who have observed that their cycle pattern has changed, or the women have multiple or say frequent cycles compared to previous cycles. We advise these tests to them, because similar to PCOS and thyroid dysfunctions, even low ovarian reserve can cause menstrual disturbances. If timely diagnosed, we can immediately is act accordingly and see that the patient doesn't land into bigger issues. And now that you have known and you came to know that you are ovarian, first, don't panic. It is very common for a woman to get stressed once she learns that ovarian reserve or reproductive potential is endangered. You have to do once you know that your reserve is going down. Certain things which you have to do. First thing is you reassess. We can retest it, because sometimes a single value may not give us the appropriate value of your ovarian reserve. So we can redo the test in a fresh cycle and confirm whether you have the problem or not. So once we have done the test, we repeated the test, and you have confirmed that you have this issue, then first thing is you have to accept and acknowledge that you have this problem, so that you will start looking for a solution. So accept that you have a health issue and consult in that area, so that they will help you to overcome this issue. You should be in regular follow up, and whenever required you have to take necessary treatment, so that not land in a major issue later on. So now coming to the management of females or women who have low ovarian reserve, there are two number one, are a kind of cells cannot be regenerated or rejuvenated once they are lost. So forever. And secondly, though it's disappointing, currently there are not treatment methods to increase your ovarian reserve. And whatever method they do ovarian reserve, like PRP or stem cell therapy, they are based, and there is the efficacy of these methods is not yet proven. But yes, these treatments can, to some extent, improve the quality of the egg, especially in younger women. And the quality of the egg may improve by around 10 to 50%. That too is for short, say 2 to 3 months. So if at all you want to go for these rejuvenating treatments, you have to go before you go with IVF treatments. Just prior you go, say 1 or 2 months prior, you go with IVF treatments. And the currently available treatment options, what we have are, again, they are focused towards two aspects. Increase the chances of you to become pregnant. So again, to improve the quality of the egg, we have two methods. One is most important and most neglected one is lifestyle corrections, wherein you have to take care of your diet. You have to take good diet which is rich in nutritional value, and you have to avoid all the junk food which can damage eggs, which can cause negative effects on your egg quality. Also, you have to have physical activity at minimum, so that you can flush out all the toxins which are there in your body, by which your egg quality will improve. And you need to have good sleep, at least around 6 hours of sleep, so that your body will rejuvenate and your body will become healthier, along with which your reproductive system will also improve. And the most important nowadays is handling your stress. Stress is a thing which you cannot avoid, but you have to learn how to handle your stress so that the conditions which you are already having won't worsen, and you will see improvement when you learn to handle your stress well. Because when you are under stress, your body will be releasing stress hormones which are harmful to each and every cell of your body, including your egg. So try to learn how to handle your stress. It is easy to say, but you have to follow this. You have to learn how to handle whatever stress you have, and always try to maintain healthy weight, which is also the most neglected aspect nowadays. Weight affects your fertility a lot. There are many research and many evidences stating that unhealthy weight will put a lot of toll on your reproductive system, which includes even your egg quality and even egg quantity. It is, yes, it has been proven that obese women have lower ovarian reserve. So reducing your weight and coming to your healthy BMI, that is between 19 to 25, will help you to improve your reproductive capability. Does and which can be done only by you, which we cannot do. So you have to always try to maintain good healthy weight to improve your chances to conceive, and to increase the chances of you becoming pregnant. Once all the above things have been followed, we may recommend you certain fertility treatments which are decided based on three main factors. Number one is your age. Number two is your marital life, that is how long you're married for. And third one is if you have any other fertility problems other than just having low ovarian reserve. So, for example, if you have a married woman who is married for only 2 to 3 years and she is having around borderline or low ovarian reserve, usually we start with simple treatments like ovulation induction with or without IUF. Usually, many of them they conceive with these simple treatments when they are given appropriately. If at all if this woman doesn't conceive, then we may take her up for IVF. But if we have a same young woman, but she has other fertility issues like blocked tubes, endometriosis, or problem in the sperm parameters, and they are married for more than 4 or 5 years, and she is having low or very low ovarian reserve, then she will be a candidate for IVF, because IVF will give her better results than trying with the simpler treatments. So, and we take little quick decision or early decision women who are older, like who are older than 32 or 35 years age, because for them, along with drop in the ovarian reserve, that is along with drop in the quantity of the eggs, we also observe that the quality of the eggs will also keep dropping as they age. So in older women, we always try to take early decision so that we can help them to conceive as quickly as possible. So now that we know what ovarian reserve is and what these ovarian reserve tests are and what are the treatment methods, the couple should decide what kind of treatment they have to undergo. And to make this decision, we have to consider many factors. Mainly, we have to consider your medical condition, you have to consider your family support and your family beliefs, and you have to consider your financial condition, and also you have to consider your emotional status. So based on all these factors, you have to take decision to what kind of treatment you want to go ahead with once you find that you have low ovarian reserve. And the main most important goal of doing ovarian reserve tests and treating women with low ovarian reserve is to see that the woman conceives with her own eggs. This is very important goal what we look for when we are treating women with low ovarian reserve. That means we try to see that woman conceives with her own eggs thus avoiding the requirement of third party reproduction, that is donor oocytes. And to achieve this goal, it is very important to uh, uh, have a timely and appropriate treatment when you find that you have low ovarian reserve. So that is all about ovarian reserve. Now we'll try to take a few questions. So Alok Chandar is asking, is it possible to get pregnant with ovarian reserve? Yes, absolutely. It is possible to become pregnant with low ovarian reserve. Uh, there are many ways to help you out. So depending upon your profile, if we decide what kind of treatment will work best for you. So the early treatment is more important in women who have low ovarian reserve. So, Deepthi is asking, how many cycles of ovulation induction or IUI can we plan before going for IVF? See, Deepthi, it is not fixed that we have to do certain number of ovulation inductions or certain number of IUIs before going for IVFs. It depends upon the profile. So, if the patient is having all the reports are almost normal, we usually start with ovulation induction. We usually do 3 to 4 cycles of ovulation induction. In between, we keep reassessing if we are missing anything or any new findings we see. And if the couple doesn't conceive, then we go with IUI. We usually do around 3 to 4 cycles of IUI. And then even in IUI, if they don't conceive, we'll take up for IVF. Usually this will take a period of say 6 months to 1 year time once we start treatment from ovulation induction to IVF. But this doesn't hold good for every patient, because in some certain conditions where the woman is having severe endometriosis, or when where the ovarian reserve is too low, or when the male partner is having count issues like very low counts or azoospermia, where there is no visible sperms in the semen, then we may have to take these patients directly for IVF. For them, simple ovulation induction and IUI may not work. The next question is, are there any medicines to stop fall in egg count? Unfortunately, we don't have any specific medications to stop the ovarian reserve to fall further. We can only slow down the drop in the ovarian reserve just by following good lifestyle and taking supplements. Taking supplements is very important. There are usually, when you come to us for with ovarian reserve issues, we usually give supplements like folic acid, vitamin E, vitamin D, and all. You nowadays, the diet what we are taking is lacking in so many of the nutrients, so we usually give these supplements to you. And don't think while taking these supplements that you are taking certain medicines, because you're supposed to get these things through your diet which you're not getting it. So we are giving them in tablet form or a powder form, so that the quality of the egg or quality of the sperm will improve. And when you are using these supplements, you have to use at least for 3 to 4 months to see some change in the egg quality. It will take at least 3 to 4 months time. Most of them they use for 1 to 2 months and then stop, expecting that they would work. No, so you have to use it for longer periods. The egg quality will improve slowly, and once the quality has improved, to maintain that positive effect on the egg quality, you have to continue taking these supplements, so that you will have better results. So don't stop supplements which have been given to you by your specialist, so that the quality of the egg will be maintained. And these supplements, again, along with lifestyle corrections, may slow down. Again, I'm saying that it may slow down the drop in the egg count, but it may not totally stop. So the next question is, what is the right time to seek medical help? So when a couple is trying for a pregnancy, and where the woman is less than 35 years of age, and when they are not able to conceive even after 1 year of unprotected sex, we say the couple is suffering from infertility. So when you have this problem, then you can come to a specialist, or you can go to your doctor and check your from both the sides, from male partner and the female partner, and know how much reproductive potential you're having. And depending upon the problem we find, then we decide when you need medical help. If we don't find much issues in your reports, you can try for 1 more year. But if you find any certain problem, then we start giving treatment. Depend the treatment again, the level of treatment again depends upon what kind of uh, problem you have. The next question is, will multiple fertility treatments reduce ovarian reserve? Definitely no, because when we are giving fertility treatments, we only can target or focus our whatever medicines we give, they go and act only on the eggs which have come into growth phase in that particular cycle. You will be having many eggs in sleeping stage, because we call them as primordial follicles or sleeping eggs, which they don't respond to whatever medicines we are giving in that particular month for the egg growth to happen. So only the eggs which have come into growth phase in that particular month, on second day or third day of your period, will only respond to the medications what we give. Even when we do multiple IVFs or multiple egg pickups, we can only pick this group of eggs which have come into growth phase in that particular month. Again, from next month onwards, depending upon the ovarian reserve, you will have new set of eggs or new cohort of eggs which will be coming into growth phase. So no, multiple fertility treatments will not reduce your ovarian reserve. The next question is, uh, role of ovarian testing in unmarried women. It's a very interesting question. So nowadays we are seeing women who are career oriented and who want to have a marriage after they are settled. So in this group of women who want to focus more on their career, ovarian reserve testing is of much value, because they will have this fear in their mind that if they keep postponing their marriage, they may have problems later on in conceiving. So if they keep checking their ovarian reserve on timely basis, whenever they have or they find out that there is a problem, they can go for early treatment or early intervention, wherein we can even freeze their eggs and save their reproductive potential. And for some women or some girls who have to undergo cancer treatments, though even though they are not married, we may have to do ovarian reserve testing and see that we can save their eggs by fertility preservation. We have many methods to save their fertility so that they can conceive later on after they complete their cancer treatment. So, and women already, which we have I have already discussed, who have chronic health issues, they can also, though they are not married, they can also get these tests done to just monitor how their reproductive health is or how their reproductive potential is. Yes, ovarian reserve testing has a role in even in unmarried women. So the next question is, will lifestyle affect ovarian reserve? Yes, it does. So if you have very bad lifestyle, like you have very unhealthy diet, and you have habits like smoking and alcohol intake or drug intake, or you have a very sedentary lifestyle, there will be drop in your ovarian reserve little rapidly. So we and even the stress, when you have lot of stress, because of stress also your ovarian reserve will drop rapidly. So definitely lifestyle will affect your ovarian reserve because of increase in the egg number of eggs which are dying in each cycle. The next question is, will body weight affect ovarian reserve? Yes, the body weight will definitely affect the ovarian reserve. It has been proven that women who are obese, who are overweight, they will have a kind of environment in their body where they build up more toxins in their body, which will increase the cell death rate or the death of eggs. So too many eggs will be dying when you have lot of toxins or inflammation in your body. So it has been proven that obese women will have impact on their ovarian reserve. And to the contrary, even women who are malnourished or who are underweight because of lack of nutritions in their body, again the cell death will be more and they may have low ovarian reserve. So it is always important to maintain healthy body weight to save your reproductive capability. So the next question is, what is the success rate of IVF? Um, Worldwide, the success rate of IVF in general, on an average, we can say it is around 30 to 40%. And this varies. It depends upon why we are doing IVF. For a couple who doesn't have major issues, the success rate may be touching around 40 to 50%, but who have major issues like low number of eggs and severe male factor or some problem in the uterus, may the success rate may come down. But the main determining factor for any success of IVF treatment is age of the woman and ovarian reserve again. So because if we get more number of eggs, we can get more number of embryos. The more number of embryos we have, the better success we have. This 40% of success rate means with one single embryo transfer, a couple can have a chance of having 40% chance of conceiving. Say if you have around 2 to 3 sets of embryos, that is around 6 embryos, the success chance may be around 70 or 75%. So to attain or to get those 6 good quality embryos, the age of the woman should be less than 35 and she should have good ovarian reserve. So the ovarian reserve and age of the woman will determine the success rate of that particular couple. But in general and on average, we say the success rate of IVF is around 40%. So, can ovarian reserve be improved with PRP treatment? With the current evidence, what we have, or what with the current research studies, what they say is PRP treatment may not improve the ovarian reserve. There are many studies showing that this treatment may not be helping, may not be helpful in increasing or improving the ovarian reserve. This may improve the quality of the egg which you already have in your ovaries to certain extent, but the ovarian reserve may not improve. They may not help to increase your AMH value. It may not help to increase your antral follicular count. But in 10 to 15% of women, especially younger women, it may give little improvement in the egg quality. Next question is, will PCOD drilling affect ovarian reserve? This is very important and very useful question. Many of patients, they come and ask us when they have PCOD that whether they can get PCOD drilling by which they can get rid of PCOS. You have to remember that PCOD is not the disease of the ovaries. PCOD is a wrongly named condition wherein the ovaries are the victims. They are not the site of the problem. So PCOD will not, drilling will not help you to solve the PCOD problem. The main problem in PCOD is the metabolism of your body. So because of abnormality in the metabolism, the ovaries get affected, and when we do scan in these women, we see that the ovaries are full of follicles, and these are not the cysts, they are immature eggs which got arrested in immature state. So by doing PCOD drilling, what we do is we apply heat, cautery, and burn these eggs. If this procedure is not done properly, or if this procedure is done to women who don't need it, like who don't have PCOD, who just have normal reserve and get this procedure done, yes, it will definitely reduce the ovarian reserve, because that heat which is used to do the drilling may spread beyond our control and may damage the ovary totally. So it is always better to avoid these kind of surgeries, where if we have only very selective patients, they need PCOD drilling. Those who are not responding to any kind of treatments, or those who have any other problem other than PCOD, only these kind of group of people who have PCOD will need PCOD drilling. So selection of patient is very, very important when we are doing PCOD. If we do unnecessary PCOD drilling, definitely it will affect the ovarian reserve. We have seen many patients who have gone into ovarian failure because of unnecessary PCOD drilling. So be careful when you're taking decision to get operated on your reproductive organs. Next question is, will thyroid problem affect ovarian reserve? Not all thyroid problems, kind of thyroid problems will affect ovarian reserve. It is said that some kind of thyroid problems, like autoimmune thyroiditis, because they have antibodies in their body wherein their immunity works against them and damages their thyroid gland. Similarly, they may be having abnormal immunity where that particular woman may be producing antibodies to her own ovaries. In these kind of thyroid issues, maybe women may have little lower ovarian reserve. It's not like every woman who have thyroid problem will have low ovarian reserve. There is a small group of women who have thyroid may have effect on their ovarian reserve. What are the modern techniques available to treat fertility? For now, the most advanced technique is only the IVF, and we have different kinds of IVF where, depending upon the problem what the couple have, we select what level of treatment we have to give. So we have ICSI, we have IMSI, we have what you say, sperm selection methods, and we have assisted hatching techniques, and we have PGT, PGTA, PGTM. These are all modern techniques which will help a couple to conceive while we are doing IVF treatment. What is the minimum egg count or minimum AMH value to have a successful pregnancy? Again, this is a little controversial. We cannot deny a woman treatment just based on AMH value or her egg count. So, but usually women whose egg count is less than 3 and whose AMH value is less than 0.1, usually the results are little low. We expect little lower results, and we see that more cycles will be cancelled when we are trying to treat these kind of patients. But still, it's not like we should not treat these patients. Similarly, there is nothing like minimum egg count or minimum AMH value which is required to have a successful pregnancy. We only thing is you have to keep on trying uh, to conceive without losing your hope, even though your egg count or AMH is low. So if you may have chance until the woman is menstruating, until the woman doesn't get menopause, she will always have a chance to conceive, even if she has one or two eggs, even when her AMH is zero point 0.1. The thing is, you have to decide up to what level of medical assistance you want to take. So based on that, your treatment methods will be there. So there is nothing like minimum egg count or minimum AMH value which you should have to have a successful pregnancy. The main thing is women should be still menstruating so that she can have pregnancy with her own eggs. How to improve the low egg reserve? As already discussed, we don't have any proven treatments to improve the reserve. Whatever treatments we have, they are to improve the quality of the egg, to some extent to slow down the drop in the ovarian reserve, and to increase the chances of you to become pregnant. So we don't have any proven method or proven medication or treatment methods to improve already low ovarian egg, reserve. So I think I have answered this question already. There are a few more questions. Will stem cell therapy improve the ovarian reserve? So similar to PRP, even stem cell therapy has not did not give any promising results. Again, like PRP, it may improve the quality of the egg, but it may not improve the ovarian reserve per se. So all these treatments are still in experimental stage. If you want to undergo these treatments, you should understand that these are still in experimental stage and not proven, and they are costly treatments. And if you are okay with these minimal results, you can always try these kind of treatments. Scroll. So still, if you have any doubts, you can always reach out to any of our units, fertility units, and you can also contact to the number which is scrolling on the screen. And thank you and all the best.